Welcome to a new enlightening session. Today, we delve into a topic often shrouded in silence: sexual dysfunction. This is a subject that touches lives across the globe, yet it remains cocooned in stigma and misunderstanding. Our conversation today is rooted in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, which provides a comprehensive understanding of the topic. By breaking the silence, we aim to foster a healthier dialogue around sexual health. Without further ado, we venture into this important discussion. To fully grasp the concept, we need to understand what sexual dysfunction is. It's a term that encapsulates a variety of problems, preventing individuals from experiencing satisfaction from sexual activity. This definition, as per the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, is the cornerstone of our discussion today. Sexual dysfunction, according to the DSM-5, comes in 4 main categories. The first one is desire disorders. This refers to a lack of sexual desire or interest in sex. It's like having a library full of books, but no desire to read any of them. This lack can affect people in various ways, from straining relationships to causing personal distress. Moving on, we have arousal disorders. This is when you want to read the books, but you just can't open them. It represents a person's inability to become physically aroused or excited during sexual activity. It can manifest as a lack of excitement or a lack of physical preparedness for sexual activity. Next up is orgasm disorders. These disorders occur when there's a delay or absence of orgasm. It's as if you're reading a book, fully engrossed, but you never reach the end. You're left hanging on the edge, unsatisfied and frustrated. The last category is pain disorders. This involves pain during sexual intercourse. Imagine trying to read a book, but every page you turn causes you pain. It's a distressing situation that can cause one to avoid sexual activity altogether. These categories, while distinct, often overlap. They may share common causes, and one type of dysfunction can lead to another. For instance, a person with an arousal disorder might lose interest in sex, leading to a desire disorder. It's a complex web of interconnections that makes understanding sexual dysfunction a challenging task. Now that we have a basic understanding, we can delve deeper into the symptoms. Each category has its own unique set of symptoms, and understanding them is key to identifying and treating sexual dysfunction. It's a journey of understanding, and we are just at the beginning. Symptoms of sexual dysfunction are not always straightforward and can vary widely. They're often complex and multifaceted, just like our sexual selves. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or the DSM-5, there are 4 categories of sexual dysfunction: desire, arousal, orgasmic, and pain disorders. Let's delve into these categories a bit more. Desire disorders, often called hypoactive sexual desire disorder, are characterized by a lack or absence of sexual fantasies and desire for sexual activity. It's like having a car with an empty fuel tank. The desire to drive just isn't there. Next, we have arousal disorders. This is when there's a desire for sexual activity, but the body doesn't respond as it should. It's as if you have the fuel, but the car's engine just won't start. Then we have orgasmic disorders. Here, the desire is present, the arousal happens, but the climax or orgasm is delayed or absent. Imagine flooring the accelerator. The engine roars, but you never quite hit the top speed. Lastly, we have pain disorders. This is when sexual activity, which should be pleasurable, causes significant distress or pain. It's like reaching your destination but finding the journey agonizing. Now, let's consider a hypothetical individual. Let's call her Jane. Jane has been feeling a decreased interest in sexual activity. She's been having trouble getting aroused, and even when she does, reaching an orgasm seems almost impossible. Moreover, on the rare occasions when she does engage in sexual activity, it's painful. Jane's experience touches on all 4 categories of sexual dysfunction. Navigating these symptoms can be challenging, especially when they're intertwined with our emotions and relationships. But remember, it's okay to seek help. If you, like Jane, are experiencing these symptoms, remember that you're not alone. Recognizing these symptoms is the first step towards addressing sexual dysfunction. Now, let's turn our attention to the possible causes. Sexual dysfunction, as defined by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, is a complex condition with diverse causes. These causes can be broadly categorized into 2 groups: physical and psychological. Starting with the physical causes, the primary culprits often include chronic illnesses and medical conditions. Heart disease, for instance, can interfere with the blood flow necessary for sexual arousal and performance. Diabetes, too, can lead to sexual dysfunction by damaging nerves and blood vessels. Hormonal imbalances are also pivotal. Now, let's consider a story to illustrate this. Picture a man named John. He's in his 40s, a successful lawyer, and has always enjoyed a healthy sexual relationship with his wife. However, recently John has been experiencing difficulty in maintaining an erection. After a medical consultation, it's revealed that John has an undiagnosed case of type 2 diabetes, which has been quietly damaging his nerves and blood vessels. This is a prime example of how a physical ailment can contribute to sexual dysfunction. Moving on to the psychological causes, they are equally impactful. Depression and anxiety, for instance, are two significant contributors. Depression can reduce the interest in sex, while anxiety, especially performance anxiety, can inhibit sexual performance. Furthermore, past sexual trauma can also lead to sexual dysfunction. It can manifest in various ways, such as a fear of intimacy or an inability to maintain arousal. Let's revisit John's story to illustrate this. After his diabetes diagnosis, John starts to experience performance anxiety. He's worried that he won't be able to satisfy his wife sexually, which further exacerbates his sexual dysfunction. This illustrates how psychological factors can compound and worsen sexual dysfunction arising from physical causes. It's important to note, however, that these categories are not mutually exclusive. Often, physical and psychological causes can intertwine, making the situation more complex. For instance, a person with a chronic illness may develop depression or anxiety, which further aggravates the sexual dysfunction. Understanding these causes is key to seeking appropriate help and treatment. It's crucial to remember that sexual dysfunction is a common issue, affecting millions worldwide. It's not a personal failing or something to be ashamed of. If you're experiencing symptoms of sexual dysfunction, reaching out to a medical professional or a therapist can be the first step towards understanding your condition and finding the path to recovery. As we wrap up our discussion, remember, knowledge is power. We've taken a deep dive into the realm of sexual dysfunction, shedding light on a topic that is often shrouded in silence and stigma. Through our journey, we've uncovered the complexities of this issue, understanding that it's more than just a physical condition, but a psychological one that requires our empathy and understanding. We've explored the symptoms of sexual dysfunction, highlighting that these signs can manifest differently from person to person. It's crucial to remember that experiencing these symptoms does not equate to weakness or failure, but are merely indications that professional help may be needed. We also delved into the various causes of sexual dysfunction, which can range from physical ailments, psychological factors, to the side effects of certain medications. This underlines the importance of a comprehensive approach in addressing sexual dysfunction, requiring us to look beyond the surface and appreciate the interconnectedness of our bodies and minds. Let's take a moment to revisit the story of John, our case study in this discussion. John's struggle with sexual dysfunction serves as a vivid reminder that anyone can be affected by this condition, regardless of age, background, or lifestyle. His journey towards understanding and addressing his condition is not only inspiring, but also illuminates the importance of seeking help and breaking the stigma around sexual dysfunction. In a world where discussions about sexual health are often suppressed, we must remember that silence is not the solution. It is through open conversations, education, and understanding that we can start dismantling the barriers and stigma surrounding sexual dysfunction. So, I encourage you to share this information with others. You never know who might benefit from it. Before we conclude, let's remember that help is always available. If you or someone you know is experiencing symptoms of sexual dysfunction, reach out to a healthcare professional. There is no shame in seeking help. In fact, it is a testament to your strength and resilience. Thank you for your time and attention. Your willingness to learn and understand makes a difference. Until next time, stay informed and take care.